Matt, you are headed to Congress later today to testify in a hearing on patient care. I assume that's why there's so many news trucks on Capitol Hill today.
I'm sure it's all about me, yes.
Yes. You could be a speaker candidate if you hang out there long enough. Honestly, I mean, we just heard Ovik talk about some of the dynamics of doing health reform on the Republican side. Can this broken Congress still do big things on health care?
Listen, I don't think there's going to be substantial healthcare legislation this year, and so I think the first real window for substantial legislation is after the 2024 elections. And I think exactly what that might look like is obviously going to depend very much on how those elections go. I mean, I think one looming question that's going to be facing Congress after the 2024 elections is, during this administration, there's some expansion in the ACA subsidies, first in the American Rescue Plan and then extended the Inflation Reduction Act. That only goes through 2025. What happens with those afterwards? I think another big looming question, again, if there's Democratic control in 2025, one of the big things the ACA did, obviously, was expanding Medicaid, giving states the option to expand Medicaid to low-income adults. There are still 10 states that haven't done that. And there are millions of people in those states who are uninsured because of that. So there was an effort over the last couple of years to try to figure out whether there's a federal way of plugging that gap. I think that's going to be another sort of looming healthcare issue. And then I think there are some issues on the cost side. I think one place where we probably agree is site-neutral payment. So there's an issue where Medicare will pay a lot more for the same service in a hospital outpatient department versus in a physician's office. Doesn't make a lot of sense from the perspective of Medicare's balance sheet or from beneficiaries' costs. Doesn't do much to improve access and probably drives sort of hospital acquisition of physician practices that reduces competition in the private market and drives up prices there. I think there are a variety of other ways we might think about tackling costs, but that would be the conversation that one would hope we would be having in 2025. We'll see if that materializes.